So, good evening. Just a quick, short sort of introduction. My name is Ramzia, and I work for a charity called Paiwand Afghan Association. We serve the refugee community in Northwest London. We've got different teams working together, and if you'd like more details on that, we can do that at the end. Just message me anytime on the chat as well. I'll be happy to do that. I'm just going to start sharing the screen because we're running quite late and I want to be able to make sure that we have finish on time. So today we're gonna, as Cobra said, we're gonna talk a little bit about depression. Last week we talked about understanding mental health, and depression is one of the most common mental health issues. In my practice, I think virtually about 80% of the cases we have is depression and anxiety linked. So just ground rules, as I like ground rules, so that we're all on the same page. This is a safe, we're trying to create a safe and comfortable environment for everyone. And so that means just listening and respecting each other. If you do share at one point or another, please share whatever you feel comfortable with, and please don't record the sessions as we're doing it, and take care of yourself. By that I mean, if any of the stuff that we dismantle today, if it triggers anything, if it brings anything up for you, you can choose to either step away from the computer and come back when you're ready, or you can leave and then come back. Just look after yourself. That's the most important thing for me. So we'll dive right into it. I just want to be able to give you a little bit of what depression is, because there is this mishmash of sadness and depression that usually gets misunderstood or used interchangeably. And some people, they do sort of talk about, well, I'm feeling depressed, but actually they're just feeling sad. And this creates a lot of misunderstanding. I think last week we were talking about the language that we use around mental health. It is important to do that. Depression is a clinical term, and it should be used appropriately. So depression is characterized by a depressed mood and or loss of pleasure or interest in activities, feelings of intense hopelessness and worthlessness, which is at the core of depression, and the symptoms and other symptoms that affect everyday life and functioning for more than 2 weeks. So that's very important distinguishment to make, which I'll sort of touch a bit later in the next slide. It is a medical illness that involves the mind and the body, and it's more than just feeling the blues or down in the dumps sometimes, or even sadness, as I talked about. It interferes with the person's function in daily living, relationship and work life. So for it to become a clinical diagnosis, it has to be a reoccurring thing, and that's the difference between depression and sadness. And it's a condition that requires diagnosis and treatment by a trained healthcare provider. So a lot of people, like I said, very casually sort of use the word depressed when they're feeling sad, but actually depression must be diagnosed by a healthcare provider, like a counselor, psychologist, psychiatrist. So depression versus sadness. So sadness is a feeling of sorrow or unhappiness, and depression is it feels almost the same. But the difference is in the lasting of it, so the reoccurreness of it. So sadness and depression have similar reaction, except depression lasts longer than sadness. That is the key point. And depression can affect someone's mood, causes them to feel drained, causes someone to feel exhausted and tired and down for weeks and months, and sometimes for years. Sadness doesn't last very long. It can be something that makes you sad that day, and then you get over it. So basically, sadness is a feeling that you get sometimes. It may be induced by certain sort of incidents, or events, and then it sort of just leaves by itself, whereas depression stays put.
So is sadness, could it be like when you're going through a particular thing in your life, for example, when you've lost someone that you love, or you're going through a difficult situation, would you say it's a temporary thing, and depression
Yeah.
affects a lot more?
Yeah. So sadness is, for example, you've lost something, you've had a loss. If it's a mild form, so you do get over it after a couple of days, and then it might visit you again, and then it might come back. So it's like a sort of up and down sort of, and we all experience this. But depression really it stays for more than 2 weeks. The sort of diagnosis needs to be done sometimes 2 weeks, sometimes some other evaluations have sort of a month. So it's sort of reoccurring. Okay.
Yeah.
Got it. And so what is not depression? And that's very important as well. I'm a big fan of, what something is and what something isn't, that because that will give you an idea. Okay? So sorry, I'm just wondering if everybody can mute. That would be really helpful. So what is not depression? Depression is not a normal part of aging. So some people say that as you get older, you get grumpier, you get more sort of sad, you get more sort of reserved, and they describe that as depression, but that's not the case. We can all live, everybody can live a fulfilled life until maybe 80s, 90s, until the end of their life, basically. So it shouldn't be part of normal aging, okay? It's not something to be ashamed of, definitely. It's not something that, I think there's a stigma around it, but there's nothing, and that sort of is linked to a lot of people that maybe for cultural reasons, a lot of people think that depression sort of is an indication that you have you're weak, but that's not the case. And it's not a character flaw or a sign of weakness, like I said. Unfortunately, it is sometimes used in that way, but that's not true, and it's not something that you can actually just snap out of. Okay. So some causes of depression, it is quite sort of so we have genes, and although some research, it's not, there's not a lot of research out there, but the next sort of the genes and brain chemistry are sort of still seized as causes of depression. So perhaps and mental illness generally is like that. So if it was sometimes it is sort of seen as an indication. Brain chemistry as well. Again, this is now starting to be disproved a little bit, but because it is seized a lot of the times, I've done that as well. So brain chemistry, and this is where medication comes in. This is what medication tries to do, which is to level up the hormonal or the brain the hormonal imbalance that occurs. And environmental and psychological factors. So environmental, in that if somebody is, for example, in a sort of abusive environment, for example, that is a cause of depression. And sometimes when they move away from that, they tend to come out of that depression. And psychological factors as well. So psychological factors is the cognitive styles that we grow up with, and our attachment styles as well. How our parents how we've seen our parents, and what we sort of almost copy from them. It has a effect on that, and medical conditions and medications as well. So for example, when my clients sort of come through and they've been to the GP, sometimes they actually have blood tests as well. Things like sort of deficiency in vitamin D, for example, or iron causes. One of the symptoms of vitamin D deficiency sometimes is seized as depression. So deficiency in vitamin D actually causes depression in itself, and the tiredness, for example, with the iron and stuff. So sometimes dealing with that with the difference can actually improve the depression as well.
Sorry, Ramzia, I think on your end you will be able to mute everyone's yeah, there we go. Thank you.
Sorry, I didn't know that. Okay. So there's actually different kinds of depression. Some that are quite severe and some that are quite mild as well, some that are seasonal. So for example, what I usually see is major depressive disorder. And disorder actually just means that it is sort of disturbing your everyday life. So when something disturbs it, when an illness disturbs your everyday functioning, that's when it becomes a disorder. And so in this way, depression in itself and sadness, for example, if you're feeling sad every single day or more than half of the week or more than half of the 2 weeks, then that becomes a disorder. So major depressive disorder, psychotic depression also as well. This is usually seen in a very severe cases. It is usually sometimes triggered as well with trauma as well, and I've seen it with sort of pregnancy as well. Sometimes pregnancy in itself actually triggers this as well. But also as well, there's also postnatal depression, which I'm sure a lot of people have actually heard of as well, and this occurs shortly after childbirth. It's called sometimes the blues as well. There is also persistent depressive disorder, which again sort of lasts for most days over 2 years. This is something that I see a lot as well. And sometimes the root causes of that is sometimes being in an unhealthy environment. For example, being in a domestic violence situation. So I see that quite a lot. And also as well, I don't know if you guys have heard of seasonal affective disorder. That is actually a thing, and usually a lot of people actually, when it becomes when it gets a bit darker, the nights, the days, especially in the winter months, a lot of people start feeling, quite depressed, very sort of low mood, low energy, those sort of things. Okay. And so some of the yeah. Yeah, Cobra? Did you want to say something?
It kind of oops, am I on mute?
No, you're not. I can hear you.
It kind of ties in with what you were saying last week about how it's 3D. It's not just it's a physiological thing as well. It's not just an emotion or you just feel sad or you're stuck in this state of like being so emotional. It's not that it's at all, because it's part of everything else in the human system within us, that system that's built in, hormones, the way our body functions. For example, postnatal depression, a lot of it is to do with the different hormones and imbalances. So that's really just tying it back to last week's conversation as well.
And that's why you can't. And that's why you can't just snap out of it.
Yeah.
Because
exactly.
there are other things, other bigger things playing.
Yeah.
Yeah. So some of the signs and symptoms of depression. A lot of people, and some of them are actually physiological, some of them are emotional, and some of them are mental. Okay, so difficulty in concentrating, remembering things, and making decisions. This seems to be like a mental one. Fatigue and decreased energy, that is more of a physical one. Feelings of guilt, worthlessness, and helplessness, which is more of an emotional one. Feelings of hopelessness and pessimism, insomnia, early morning wakefulness, or excessive sleeping. This has more to do with what the body is actually feeling and doing. It's the response that the body is that the body is going through. And maybe if we have a chance, we'll talk about this in the next week's session about how our bodies are responding to the hormones that are sort of let out into our bodies, and the fight and flight mode that we tend to get into. Restlessness, anger, loss of interest in activities, things that you used to enjoy that you don't enjoy anymore, no pleasure, feeling no pleasure, overeating or appetite loss. So you know, if for example you haven't been eating well, or you know, weight loss, for example, is sometimes an indication of a mental health issue going on, or even putting on a lot of weight. If you're eating your emotions, for example, persistent headaches, pains, cramps, digestive problems. So this is more of physiological, and these are the symptoms, for example, the energy and the pains and aches and stuff that actually gets brought up first with the doctor. And I think we were talking about this last week as well. Some people just feel comfortable about talking about it in a physiological sense. Persistent sadness, anxiousness, or feeling of emptiness. Thoughts of suicide and suicide attempts. This is again, I think this is something that not a lot of people like to talk about. They like to stay clear of, but it's important to be able to talk about these things because they just won't go away. Yeah. So comorbidity is sort of, so depression is sometimes, most commonly, it comes along with something else. For example, and usually it comes with anxiety disorders, okay? So it's very rare that you actually just have depression. Sometimes, most of the time, I see it with anxiety disorders. Also PTSD, conduct problems. So, for example, relationship problems, ADHD, OCD. OCD is more of an anxiety-based, learning difficulties as well, and also medical problems. So if you're going through sort of a strain, again, going back to the diagram we had with the physical, mental, emotional, it's all connected. So if you are strained medically, you know, you're sort of dealing with a medical issue, it is most likely that it will affect your mental health as well. So the treatment options, usually diagnosis and diagnosis usually sort of what the, let me start again. So when you go to the GP, there are actually three sort of options that they give you. And one is medication, and it's very rare. I think nowadays they're just trying not to, but obviously there are times when the patient does need medication. And the medication, again, like I said before, it just sort of tries to, the core sort of aim with medication is to try and balance the imbalances that may be happening in the brain. Okay. And with the psychotherapy, usually the psychotherapy is one of the popular ones, but with the psychotherapy and therapy in general, there are different sorts of therapies now available. And so, you know, there's drama therapy, dance therapy, play therapy. And therapy is just really, for me, the way I look at therapy is it's about expressing yourself, basically. It's about telling your story. This is what needs to be told, and this is what usually it's about connection. And so whatever way helps you to express yourself, whether it's dancing, whether it's art, whatever it is, if it helps you to connect with yourself, because this is what it's all about, whether it's connecting with yourself or connecting with other people, this is what psychotherapy and therapy in general does. And also as well, there's also the option of medication and therapy together, complementing each other, which I get a lot as well. And the basic sort of the core aim of all of these treatment options is just really to reduce the intensity of the illness. And also as well with the psychotherapy, for example, there's a lot of, I'll talk a bit about it, but there's also as well different dimensions of what can be done. So physically, the medication might take care of, from the psychotherapy point of view, the cognitive styles, for example, challenging the cognitive styles, challenging the feelings, which I'll talk about in the next slide. So this is one of my favorite pictures about therapy. And as you can see, the therapist is on my right, and the client is sort of all sort of mishmashed everything. And so when you do talk, when you do have therapy, it's almost like, well, we call it sort of integrating everything. It's making sense of your experiences, which is what gives the integration, which is what gives the healing. So therapy seeks to help the client to understand the link between thoughts, feelings, and behavior, because there is a link. For example, let's give an example of, it's a really dull day. One of these mornings, these winter mornings that we have, it's a very dull day, and you're just feeling very down. You look outside and you're already feeling quite sort of low mood, and you don't want to go out, right? So your thoughts and your feelings are all linked together. What you think is linked to what you feel, and what you feel is linked to the action that you will take, which is to just stay at home or stay in bed. Now, with, for example, CBT that we use, and usually with this link that I made with the thought, feeling, and behavior, usually what we tend to do is to influence what is easiest to change. And, sometimes it's easy to change your thought about things. Sometimes it's easy to change your feelings, but mostly it's easier to change your behavior. So if you get up that day and you actually go out, that will influence, your feelings about the day, and it might influence your thoughts about the day as well. So that's how we try and accept that. Okay. And therapy as well, it helps you to see perspective, because sometimes, as this lady is doing, it's actually seeing things from different perspectives. For example, if I'm holding this like this, you can see that it's a square and it's a phone, right? But if I hold it like this, you actually see just a line. They're both the same, but you're seeing it from a different angle, and it will give you perspective, right? It will help you to understand what needs to be done, and where sort of you can make changes. Yeah. Reframing. Oh, there's one more person joining us. So reframing our experiences and seeing things clearly. Sometimes when we are under distress, we're not able to think properly, as they say. And this has got to do with our brains and our body, how it's functioning. When we are in survival mode, that's what we need to do, survive. So there's no point in sort of dealing with our thoughts, or dealing sometimes even, the thinking brain just literally just shuts off, right? So our brain and our sort of body is built in that way for us to survive that. But once the event has sort of gone by, in hindsight, when you do sit in therapy, this is what you can do: make sense of your experiences and reframing them. Okay. And obviously it will, hopefully it will give you some self-awareness. It will help you to understand your strengths, your weaknesses, what you're good at, what you're not good at. And also as well, realize your potential. That is really important for mental health. I think last week we talked about realizing your potential is a sort of indication of good well-being. Yeah. And also as well, integrating trauma. Trauma is when you're put in a situation that you are feeling helpless in. And that sort of has a big impact. And we talk a little bit more about that in PTSD, because it's sort of the core sort of basis of what is actually PTSD, post-traumatic stress disorder. After the trauma, after you've sustained the trauma, comes the post-traumatic, the PTSD, which is a lot of, your body just reacting to the trauma. And so by therapy, you're able to integrate that within the story that you tell yourself. Okay. So coping with depression. I personally believe that, as long as I think we've talked about this, I think last week as well, as it's very important to seek intervention as soon as possible when you do feel like this, right? Some people come after 2 years, 3 years, 4 years, and seek that intervention. That's okay, but by that time, I think it becomes quite severe. So the sooner you get the support, the better it will be. And sometimes that support, mild cases, for example, take only 6 sessions. I've worked with only sort of 6 sessions, 6 weeks, in which it's sort of the intervention is actually successful. So the sooner you actually seek the support, the better it is. But these are the things that you can actually do to help yourself if you're feeling a bit sort of like mild symptoms of depression. Reaching out and staying connected, it helps to provide perspective, and it gives you support. Now, everything that I'm probably going to list here is exactly what the depression is sort of stopping you from. So I'm not saying that it is something very easy to do, but when you're depressed, you want to isolate yourself. So connecting is much different. Yes. Right? So reaching out and staying connected is actually challenging the depression. Okay, so it gives you support. It gives you support in that you're not alone, but also as well, it gives you healthy perspective as well. Okay. Do things that make you feel good. Again, one of the things on the evaluation form that we do is I don't feel happy or feel pleasure in doing things. If you don't feel like doing something, you're just not going to do it. So it's actually counter sort of it's going against the depression. So doing things that you enjoy and support your health. Okay. Get moving, so boost your energy. Again, I think I see depression in my head. I see depression as a very stuck sort of place. A lot of people describe that as well, very stuck. So once depression does kick in, the best thing I think to do is to move, whether that's physically moving or whether that's mentally and emotionally moving. Okay, so getting out and walking, dancing, just shaking your body around as well. Anything to sort of move is actually challenging the depression in itself. Okay. Eating healthy. We all love sugar, but sugar is sort of it's very harmful. It gives you that crush, the sugar crush that happens. Vitamin B, omega-3 stabilizes the mood, and magnesium. There's research that shows that having magnesium actually it's used for tiredness, but it's also used as a mood stabilizer as well. So sometimes I do suggest, getting magnesium for my clients. And some of them do come back and say, actually, it's helped them with their tiredness, for example. And this is more about the sort of physical side of things, right? We need to sort of take care of all aspects of us. Okay. Improving sleep hygiene. Again, you might not be able to go to sleep or stay asleep, having disturbed sort of sleep, but sort of having a routine really helps. So getting up at the same time and sleeping at the same time, having warmth of lighting in the room in the evenings, for example, that sets the mood. Not using your mobile phone, because the light on the mobile phone is actually it sort of keeps you awake a lot of even an hour or two after that. It's very sort of, it affects your eyes as well. There's different things that you can do to actually improve your sleeping, right? There's, for example, a worry box that I sometimes introduce to my clients. So putting all your worries in a box before you go to sleep, and then coming back to them in the morning. Sometimes that just empties your mind. Reduce stress levels. Again, this is about, I think one of the things that helps is exercise. Exercise is really sort of, sometimes I've heard, and I personally believe that the antidote for anxiety, for stress, is actually relaxation. And so finding ways on how to feel relaxed is the actual antidote for anxiety and stress. So breathing, for example, doing breathing, meditation, all of these things, because when you're stressed, something happens in your body. Again, we'll talk about this next week, but something happens in your body. And so you sort of go out of your window of tolerance. It's called a window of tolerance. So you need to be able to bring it back. That all happens with you not knowing it's actually happening in your body, in your nervous system. So calming your nervous system is the key. Getting a daily dose of sunlight. Having a routine is very, very important. Even if you don't feel like getting up from the bed, having a routine and a structure really helps. Create a wellness toolbox. So, for example, have a box with different sort of things that you enjoy, that gives you, a sense of relaxation, and picking that up every once in a while. Challenging negative thinking, changing patterns. This is usually done in CBT, but also as well in psychoeducation that I do. And mostly this can be done in, you can do it through self-help books as well, but professional help and professional support is really the sort of best place to get that from. And seek professional help, definitely. I think the most effective thing that can reduce or remove mild to moderate depression is actively committing consistently to some basic changes about how you live or how they live. And this can be done with or without medication or counseling. So one of the core things that I see in therapy is if a person is willing to make those changes and is motivated to help themselves, I know that they will get through it. If a person comes through and they just don't want to be in the therapy, they don't want the help, then I'm afraid there's not much that can be done. So I think having that mindset is very, very important. It provides the motivation for the change. And I think that's it. I think I did it on time. I hope that wasn't too rushed, but I hope that gave you a bit of a glimpse about what depression is. It may sound like quite a complicated sort of problem or illness, but a lot of the times it's actually understanding your body. It's got a lot to do with your experiences and also your body as well. I'm just going to stop sharing, and then we'll sort of have 10 minutes for questions.
I don't know if anyone noticed, I was very quiet in this one. Last week I was talking and interrupting, but I was just cautious of the time, so I didn't want to interrupt. But the whole time I was making notes, because obviously this is very informative for me as well. And I've got lots of points here to say, but I will let everyone else ask their questions first. Any questions? They might go through to, I think maybe Ramzia, you'll be able to see them.
Yeah, so I don't have questions, just some feedback. I really like this picture. I'm not sure which one it was, but explains it without words.
That was the animation you had with the two people, and one had all the confused thoughts and then the other one had the spools of wool.
Yeah.
It just made it so simple without words, which breaks down language barriers.
I think also one of the things about therapy, it's just a space for you to figure it out for yourself what's going on inside, because it's not about, I know lots of people who just want like the answer to something, right? And maybe that's the way we're built, that we just need something quick to figure it out. But as that picture showed, things are so entangled that if you just try to pull, it's just not going to make any difference. You have to sit and untangle and unwind and see figure out what is your actual story. Like sometimes if you're in therapy, that's maybe the first time you're sitting down to like figure everything out for the first time. So yeah, that was quite a very, very good picture. I think it reflects it quite well, therapy.
Are you happy to email that out to us? Because I think that would be really helpful when we're working with families, particularly where there's English as a second language. Because we quite often work visually with children, I'm just thinking that would be quite a simple one of, you know, just to show you, just to untangle your thoughts, but in a safe way so they don't get all knotted up.
Yeah.
There is another question here. There is a question. It says, the point about what brings about depression, there was a mention of genes. Is depression linked to genetics?
I think there is, I mean, this is always seized as a cause for depression. I'm a counselor, so I see things a bit differently, and not, I think that's mostly a medical sort of view of that, but I don't, and obviously there must be some research on it. But one thing that I can mention is something that is now recently being discussed is intergenerational trauma. Intergeneration trauma is when the trauma actually sort of travels down generations, right? And sometimes it's done without, you know, the person actually. I was reading an article, and this person was feeling very depressed, and he just didn't know why. But he would have this picture with him, sort of being in, for example, in a train station. And so if when they sort of went through their family history, they realized actually there was a suicide in the family, generations ago, and this person was actually carrying the trauma. Another one for generational trauma is, for example, slavery. We don't usually talk about it, but it's had such a huge impact on, you know, people of color, and they are carrying those sort of traumas around. So although, you know, I can't say, because I'm not a medic, if it's related to genes or not. There is research for that, but that is more of a sort of medical sort of view. And it's valid. But as a counselor, I see things more of a picking things up. It's more of a behavioral thing, I think. I don't know.
Just on that point, when you're talking about intergenerational trauma, so my background, for those of you who were not here last week, is that my background's in law, and I work in immigration law, and I spent a few years working with asylum seekers, which is really what has sparked this conversation. It sparked the Afghan Tea Company, and trying to challenge perceptions. Mental health is one of those things that will be a generational trauma, especially for migrants, because you have those who have come, for example, from a war-torn country, right? And those parents who have come, or grandparents, they've seen war, they've seen famine, they've seen really difficult situation, whatever their particular situation is. They come into, for example, the UK or America or the Canada, wherever it is that they're going, and they have lost their identity. And so they have certain behaviors that are as a result of what they've seen, or as a result of their fears and what they want to have for their children. And then they put that onto their children through their behaviors. So it won't be like, that's not something that's going to be in their, I wouldn't say it's sort of like inherited, but it's something that from their behaviors of how they treat their children and how they implement certain values in their home, it becomes, you know, passed on trauma. Because that I have, for example, you know, I can't say that I've ever seen a war, but I can feel how others around me have had the impact of war or poverty, or, you know, such things as other like that will then, it's as if I've got the same kind of impact of it. So that, I think that's quite an important point. Although, as you said, there is research to show that, I mean, from the research that I've seen, and you know, I'm not going to say that I'm a pro at this, but there are some people who are more prone, and so maybe circumstances would then make them more prone to getting depression. Premenstrual moods. There's another question. It says premenstrual moods. Is that quite common, as I find I am experiencing these more often and more severely the older I become? Can these be resolved through therapy?
I'm not sure how common it is, but I know that as women, I think we all I think as women we all have experienced this. So it is very common. The older you become, I'm not sure sort of the connection between age and stuff, but definitely it's something that can be resolved because it can be resolved in therapy. We can talk about moods, we can talk about different ways of sort of implementing, or managing the moods and stuff. So it's definitely something that can be resolved through therapy.
I think we mentioned it this week and also last week about how when you have a mental health problem, or you're going through a trauma, or you're having a sort of these kind of feelings, it sits in your body as a physical pain as well. And so we talked about how it impacts you in different ways. For example, your digestive system, it will impact headaches, neck pains, aches and pains everywhere. And so that, I think, also could be part of that, like, it sits in your body.
Yeah, definitely. I sometimes, I mean, especially when I'm working with trauma, I usually sort of work with the body, the mind, and the emotions as well. So, doing the breathing, for example, getting a massage, for example, taking that trauma out of, that's what massages usually do. Opening the chakras, for example, Reiki, all of these things, yoga, meditation. I mean, yoga is actually research has shown that it helps a lot with sort of the nervous system, calming the nervous system with stress, with depression, with anxiety. And that's become, a lot of psychologists and counselors actually prescribe that.
Yeah.
I think I'm quite, because we were speaking before other people joined, and I know you spoke last week about having those conversations. For some of our families who don't necessarily come to us in early support or community services, how can we start those conversations? Because we don't want to, it's all good and well us putting events on and parent engagement events and things like that. How would you, is there some way from your experience that we can start having those conversations where people start thinking, well, maybe we can just step over their front door and see what they've got to offer?
I'm a big sucker for relationships. I think I mentioned this last week. It's all about, I think, building those relationships, being curious about their culture, about what is over there, and also as well, I think speaking indirectly. Some people just don't like when it hits too close to home. So talking about examples from the outside rather than you have this problem or I can see that. So it's almost like showing a mirror, but not saying that this is you.
So kind of like when they're watching a film,
yeah,
and something resonates with them, they go, oh. So it's not about them, but they can recognize something.
Yeah, and that's sometimes called planting the seed. You plant the seed and then they do the thinking. And this is something that usually sometimes as well, a lot of people ask, well, how, if for example, a loved one is feeling depressed, how do I get them to seek help? And sometimes you can plant those seeds, for them to do the cognitive thinking in that regard. And also as well, I think connecting with them with, again, physically. So they rather talk about the physical. So my first couple of sessions, sometimes with certain clients, it's all about physical. What are you feeling in your body? And then slowly that turns into emotions and what I'm thinking, what I'm feeling, sort of thing. So connecting with the client where they are is, I think, very important.
I like what I was just picking up what Asma was saying.
Yeah, very good. I think we need more open events in the community where people can attend and get more information about what support is available, perhaps in Farsi as well, so the older generation can see support on offer. That's I mean, having it in their language would be ideal. don't know
I mean,
how
we
many
are
there are.
currently we do have seasonal women's group. I've run a couple, and my colleague is currently doing one as well. Just talking, I mean, I had one on relationships that was very popular, understanding healthy relationships, unhealthy, abusive, and then talking around that. For example, we had one, I did one in integration, for example. My colleague is right now doing about trauma and self-care, and that's all in Farsi. She's doing it through an interpreter, but it is open for women.
I think we need to promote the events a bit more than
Yeah.
if they already exist. Yeah.
I would
Yeah.
definitely like you to link in with me, because we've got an early help practitioner who is linking into a resource directory for people, because if professionals, we don't know what's out there, how are we expecting people and families to know what's out in Harrow?
Yeah.
But what languages do you guys offer services in?
So Farsi and Dari, which I do directly, my sessions are also run in those languages, and English as well. We have a Arabic co-worker as well who does sessions in Arabic and obviously English, and we can provide Pashto translators as well. So yeah, those are the languages that we use.